Hello, TI communities. I'm Evan Tate. I'm a resident healthcare coordinator at San Mateo Apartments here in San Antonio, Texas. Hope you all are doing well. I got a little kind of discussion for us today about hypertension, about what it is, some risk factors, some complications that can occur. And also kind of how to manage it and how to better control it. So to start off, what is hypertension? Hypertension is known as long-term force from your blood onto your arteries inside your body. And so basically it's just more long-term pressure on your arteries. And if like with pipes, if there's too much pressure than what the pipe can handle, sometimes that can cause complications. It can burst, it can various complications. So long-term pressure on the arteries. And this can occur for many other different reasons. This can occur through sometimes just age. As people age, I know particularly males, if you're younger than 65, it's more likely that you'll have it, just how one's body changes. And for women after 65, it's more common for them to have it just due to how their body changes as well. Some risk factors is, again, age. Male and female kind of varies in that. Race, African American heritage, it's more common amongst them. Family history as well. Physical inactivity, overweight, use of tobacco, high salt or sodium intake, and the low potassium diet. Increased alcohol consumption. Stress can also increase one's blood pressure and can kind of make that increase for longer. Diabetes, increased caffeine use, and also pregnancy, but pregnancy can be just a temporary increase in one's blood pressure. Some symptoms of blood pressure. The thing with high blood pressure is you might not most likely you probably won't have a lot of symptoms. It's known as the silent killer because you can have really high blood pressure and you might have absolutely no symptoms. I know in the hospital where I work, there's a lot of patients that come in, they have very high blood pressure, very like critically high, and they're like, oh, I feel totally fine. But that can lead to a lot of complications that we'll get to in a little bit that can be very lethal or life-altering if not controlled properly. There are some like kind of non-specific symptoms related to hypertension, such as headache, shortness of breath, and nosebleeds, but these aren't really necessarily specific to hypertension. Hypertension, so, is obviously high blood pressure. And so normal blood pressure is anything less than 120/80. When you go to the doctor and get your blood pressure checked, they'll give you two numbers, and those just kind of say what the pressures are related to your cardiovascular system. And so high is anything above that, and the more and more higher it is above that, they kind of put you in categories that you're kind of low risk for hypertension, like you might have pre-hypertension or just hypertension. And so it's good to go to your doctor once a year, twice a year, get your blood pressure checked, and talk to them about how to control it or how to prevent it better for you. So some other causes for hypertension, again, sometimes it just gradually increases over time. And sometimes there's not necessarily much you can do about it except for healthy living. Some other things that might increase one's blood pressure kind of indirectly is sleep apnea. So if you wake up and you're really tired and you snore a lot, that might be an indication. Kidney problems, thyroid problems, congenital defects, just genetics you have that kind of alters your heart structure. One might be more at risk. Certain medications like birth control, decongestives, and cold remedies can increase your blood pressure if you use them for too long, and also a lot of illegal substances as well. Some complications. So again, if that blood pressure, if your blood pressure gets too high for your body to handle, it just can't handle it anymore. And so some complications that can occur are heart attacks, just because your arteries, sometimes it gets injured, it gets like stretched, and then it needs to repair, so it'll send clots there. And then sometimes they can break off and then land in your heart, and then it blocks the blood flow in your heart, which is a heart attack. Also strokes, similar reasons. It can send a clot into your brain, and then it blocks blood flow to your brain, and then can be very complicated too. It can also cause another kind of stroke where you have a bleed in your brain, which is another complication as well. It can also cause aneurysms. Aneurysms where your blood vessels, due to high blood pressure, they start to stretch and expand, which they're not supposed to. They're supposed to be very narrow, but sometimes they will kind of stretch. And sometimes these can burst, and then blood goes in your body where it's not supposed to go. And that can be very dangerous and very lethal as well. It can also decrease your kidney function, because when your blood pressure goes up, specifically your kidneys, it kind of decreases the blood flow to your kidneys, which results in just your kidneys aren't working and functioning quite as well. And so that's another complication. It can narrow the microvascular portion of your eyes, which can compromise your vision. Diabetes, due to just all that high blood sugar, high amount of sugar in your blood, your body will develop hypertension as well from that. Heart disease, it can cause heart failure just due to your heart needing to continually pump harder and harder, and eventually it will get really tired that it just can't keep up with the body's demand. And it can also cause dementia, or increase your risk for dementia, just due to that increased microvascular compromise in your brain. Your brain can be very sensitive to that, and so it's been shown to cause increased risk for that as well. So what's the treatment? Healthy lifestyle can be a great way to prevent it if you're at risk, and even keep the hypertension away to some degree. So healthy diet, eating a balanced diet, vegetables, grains, protein, an appropriate amount of those. Eating a low sodium diet can be really good. And I know none of us really like to eat bland food necessarily, but there are a lot of other spices than just salt. You can get, there's all sorts of different seasonings one can use. So trying to stay away from the salt. The sodium can be helpful for your blood pressure as well. And it also helps to eat other sort of electrolytes like potassium, magnesium can be great substitutes that will actually help your cardiovascular system. being physically active can be a really good way to handle it as well. Weight loss, if one is overweight. Limiting alcohol consumption is another good one. Not using tobacco products because nicotine increases your blood pressure, and that doesn't really help the issue. Stress management, stress just increases one's blood pressure, and then managing stress can also help kind of manage one's blood pressure as well. It's also important to monitor one's blood pressure, go into the doctor, get in a checkup once or twice a year. Or if you're like at the drugstore, sometimes they have those like self-use blood pressure machines, and those can be really helpful. But those kind of just give you an idea. If the results seem a little bit concerning, follow up with one's doctor to kind of get a better idea and maybe a more accurate one. Sometimes, and for the management, it's important to kind of utilize all those the best one can. So, and there's also medications, which you'll need to talk to your doctor for the best plan of that. Sometimes they use diuretics for you to kind of get rid of excess fluid so that there's not as much fluid in your body for your heart to pump, which can be very helpful. And there's also meds that lower one's blood pressure due to kind of blocking like electrical pathways slightly so that your heart kind of slows down and rests. It doesn't have to pump quite as hard. Some alternative hypertension management, increasing one's calcium consumption. Leafy greens, bananas can be really good for that. Magnesium and calcium, increasing those or getting supplements for those. Folic acid, omega-3s, and also garlic can also increase one's or lowers one's blood pressure. And so it's important just to implement small things in your day that is going to help you become healthier. If you eat a banana a day, or just kind of make it a priority to do one thing better for your health, every so often, and just stick with it, make it a habit, can really go a long way and can really help us stay healthier. And sometimes just the goal is, hey, I'm just gonna, and a little bit is better than nothing. I'm gonna drink an extra glass of water a day. You're gonna be healthier for it. I'm gonna eat an extra banana a day, or I'm gonna eat some more fresh vegetables, or limit one cigarette, smoke one less cigarette a day. Just a little bit can make a difference, and it's just baby steps to becoming healthier and healthier. And a little bit healthier is healthier. So that's all I got for us today. I hope you all are doing well, and I hope you all learned something new about high blood pressure and how to control it better, and I hope you all implement these in your daily living. All right, have a good day. Bye-bye.